I'm Dr Tania Widmer. I'm an obstetrician gynaecologist here on the Gold Coast at Grace Private for Women. For many women who catch COVID-19 during their pregnancy, the disease will be mild and unlikely to affect them or their baby that they're carrying. Pregnancy, however, is considered one of those situations where women are at higher risk of developing severe disease. This is more so in women that are unvaccinated or women that are pregnant and have underlying medical conditions such as pre-existing diabetes, high blood pressure, heart disease, or lung disease like asthma, especially if it's not well controlled. It's important to remember that if you develop COVID-19 in pregnancy, that it's not your fault, and you'll be safe, and we're well equipped to look after you and your pregnancy. Yes, absolutely. Getting a vaccination is the most important thing you can do to protect yourself and your baby from getting severe COVID disease. The peak medical bodies in Australia have reviewed all the available evidence that we've gathered mainly from studies done overseas where large populations of pregnant women have undergone vaccination at various stages of their pregnancy, and there hasn't been any evidence of harm to the woman or the developing baby with any vaccinations that are authorized for use in Australia given to pregnant women. It is reassuring to know that COVID vaccination does not affect fertility. With the studies that have been done, we're also happy to see that there hasn't been an association with miscarriage, preterm labor, or stillbirth if women have had vaccination in pregnancy. So we know it is safe to have a vaccine administered at any stage during your pregnancy or while breastfeeding. We have found that most of our pregnant women have taken up COVID vaccination reassuringly, and this is such an important step to take to protect from developing severe disease. Many women might have had their vaccinations many months ago in preparation for an outbreak and are now due for a booster. So boosters can be administered during pregnancy at any stage. So if you are eligible and due for a booster, please arrange to have one. We know that immunity developed after vaccines declines as time goes on. So the booster that has been administered has been shown to increase immunity, which is what is required right now with the more contagious threat of the Omicron variant. Absolutely. The hospital and the maternity ward are well equipped to care for women with a COVID positive diagnosis. We'll take all the appropriate precautions, but we can keep yourself and your family safe. Most importantly, don't panic. We have already cared for a number of COVID positive women during labor and childbirth. And the Gold Coast Private Hospital maternity staff and all the Grace doctors are well equipped to care for you at that stage. Absolutely. If it is your desire to breastfeed your baby, it is very safe for you to continue to breastfeed despite a COVID positive diagnosis. Obviously, the likelihood of COVID currently is reasonably high. Hence, if you develop any symptoms that are suggestive of COVID-19, it is important to get a RAT, rapid antigen test, or a PCR test if it is practical. Do let us know if you have a positive diagnosis and continue to remain isolated while you are awaiting your test results. It's important to isolate at home until you have completed the required isolation period as per current Queensland guidelines, and monitor for symptoms that could suggest severe COVID. For most women, the condition is relatively mild, thankfully, and hence, mild headache, joint and muscle aches, fatigue are very common and usually pass within 2 or 3 days. For any of those minor symptoms, it is very safe to take paracetamol at any stage of your pregnancy. So paracetamol can be taken every 6 hours to manage any headaches, pain, or feeling unwell. It's important to stay hydrated and just to eat and drink what you're comfortable with. If you are at home and you're developing any symptoms that are suggestive of the disease becoming more severe, like increased respiratory rate or fast breathing and feeling very short of breath, dizziness or fainting, or coughing a lot or coughing up any blood, it is important that you attend an emergency department. Our emergency department here at Gold Coast Private Hospital is very happy to see you, and they are equipped and able to assess you to determine whether it is safe to continue to manage your disease at home or whether an admission in the hospital might be required. As always, the health and safety of yourself, our patients, but our GRACE staff and people that are working in this environment is of utmost priority. Currently, all appointments are continuing in rooms. However, at any point in time, you're able to convert to a telehealth appointment if you prefer. If you have a COVID positive diagnosis, it's preferable to not have a face-to-face review unless there is something urgent or emergent that requires that. So for routine antenatal appointments, we have been converting to telehealth appointments where a lot of the symptoms can be assessed and covered. And if a face-to-face review is required, that is then done as soon as practicable. Or if it's urgent or if there's an emergency, of course, a face-to-face review can happen at any time.